Awesome. Everybody can still hear me? Okay, cool. Well, welcome to the, I think we're on the fourth installation of Mondays with Dr. Sandi. I'm Dr. Sandi, for those of you who don't know me. I'm located in Arcata, California, and we are covering all kinds of topics. Today, I'm super excited. We're gonna do a couple of releases for the face and the head, and we're gonna talk about sleeping positions. So we're gonna talk about sleeping position, and I'm just realizing Mr. Bones, I don't know Mr. Bones. He's like casually sitting on my couch. I think that's kind of funny. So sleeping. Right now I'm getting a lot of people with really weird rib things happening, and a lot of people are complaining about their arms falling asleep. So I'm going to go through a couple of alternative positions that you can do for sleeping. Now, these are not like things that you should do and change forever and ever. These are designed for short-term things, short-term accommodations to help with your sleep, so that you can get sleep, so that you might be able to better address. Because if you are sleeping poorly, you're not going to make any progress on making your body feel better because you feel like crap because you slept crappy. So there are a couple sleep accommodations that you can do, and again, for the short term. So, and it's to alleviate some of that tension in the neck and to try to avoid some of these weird rib things that are happening. So that's why I'm set up in this position, so that I can show you guys a couple of things. There are a few things that you can use just around your house. Obviously pillows, but pillows aren't necessarily the best thing. I like to use rolled up towels, and those are helpful in a couple of different places, and I'll show you where. So let's first address the sleepy arm syndrome. That's not a real thing, I just made that up. But when your arm falls asleep. So beds are flat, and they support you in a great way, but they don't rise up to meet you. You lay on it and sink into it. So we are not flat creatures. So there's not this, I mean, and a lot of mattresses will claim that they do those things, and some of them do. And I'm not a proponent, I'm not like supporting one mattress over the other, because they're, who knows, you know, there's not one right mattress for everybody. But there are things that you can do that then accommodate your own mattress to help support yourself. So I'm going to grab my tools. So I have 2 pillows here, and I have a rolled up, just like regular towel, and it's kind of long. I'm just gonna, okay, so it's kind of long, and I'm gonna leave this close, but it's not what I'm gonna use first. So that sleepy arm, if you lay, normally you lay like this, and you lay all comfortable, but then it leaves this arm to take on a lot of support, and normally that's fine. But there is a way, if you put a pillow down first. So I'm going to put my hip on that pillow, and then I'm going to lay down so that pillow ends right here at the top of my, really the bottom of my armpit. Then there's a little extra space for my arm to be. But then you have to support your head correctly. So if you support your head, you also want to make sure that you're not tilted down. So this pillow is probably not the best for me. Even if I tuck it, you should always tuck it up to your neck. So this is a good place where you can roll up a hand towel. Now this one is too big, but I'm just going to use it for the demonstration. You can tuck that pillow underneath your neck there. So here I have more room for my arm. My neck is supported better, and I'm quite comfortable here. You can bring this arm down. What this will also do is it'll prevent you from tucking your head down, because that will also compromise some of the structures on the side of your neck, so that because that's what's going to cause that arm to go to sleep. So that's one. So recap. So you want your, if I were to look at you and draw a straight line, you want a straight line from like the middle of your forehead through your breastplate down to like your pubic bone. So if your head is tilted too far to one side, that's what we want to avoid. Tucking, because that's going to compromise and make the arm fall asleep too. So that's like the arm, helping the arm from falling asleep. The other complaint that I find is that people say when they lay on one side, their leg will fall asleep or they feel funny on that hip. So the exact same way that I just rolled up that towel to support underneath my neck, you can do that same thing at your waist. So there are some really skinny waisted people. I don't have that problem, but if you did, you can roll up the towel just the exact same way that I did at my neck. So I'll go back to my comfortable sleeping position here. And put this roll in the small part of your waist. And then that will, like I said before, the mattress doesn't reach up to meet you, you sink down to it. So this will fill that gap in the skinny part of the waist to help support your spine better and alleviate some of the pressure in your hips. So those are some of the sleeping things to alleviate some of that tension and that pressure. Anybody have questions about those? Does that seem pretty straightforward? Okay. So now let's talk about the pressure points to alleviate, like I said, the sleepy arms while you're because a lot of people, I think I have about 4 or 5 people just in the last 2 weeks that have sent me messages like, my arms are going to sleep. It's like, well, if your body is taking on all this extra tension, when you sleep, it's not like that goes away. And when you stay in one place for a long period of time, then those arms are going to go numb. So there are a couple of points that you can just release on yourself to try to make that go away. So those points are, you take your thumb and put that right, almost like you are just reaching up wherever your thumb lands. You're going to then leave your thumb there and reach around to the back part of your spine. So you'll feel the bumpy parts of your spine, and then you'll come just outside of that. And then you're going to pinch that together. Let me see if I can show you better here. You're going to hang on to that. Now, if you don't feel, if that feels kind of like you're not grabbing anything, go a little deeper. Bring your fingers lower on your spine, because you should grab a fair amount of meat right there. So when you grab that, it's not like a go for the gusto, like you're trying to, you know, make yourself call uncle. What you want to do is just enough pressure for you to feel like, ooh, that's that I definitely have something there. And then hang on to that for about a minute. And that pressure should then start to ease a little bit. The tissue might ease a little bit, and the pressure that you are feeling should ease a little bit. That's one of my favorites. So that is one spot that'll help alleviate the tension in that arm. The next one is then on the back side. So I have a little model here. So this is the back side of the shoulder. So this is my right shoulder. So right where all of the musculature here from like this is the border of your shoulder blade, as it is coming over to attach to your arm, there's this little spot here. And there's a nerve that runs right through there that'll give a lot of people these weird sensations down their arm, particularly when they're sleeping. So you can't, a lot of people can't like grab onto that because it's a weird spot. So if you find a ball, a tennis ball, a racket ball, anything that you can put pressure there, and you can, if you can reach it, it's right about here. So if you put some pressure right at that spot, it's pretty tender. It does not feel good. This is not one of those feely good movements. This is a, ooh, I can feel that. And it's more on your arm side than it is on your shoulder blade. And you can put the same amount of pressure there, like you're a little more than you're checking for an avocado, more like you're pinching just a little bit, and you're gonna hang on to that the exact same amount of time, about a minute or so. And we can do that here. And you're gonna hang on to that for the same amount of time. You guys feel that? It's not like the most fun you've had today, I can guarantee that. And that is another pressure point where you can relieve the tension in your arms. This one I'll also have people do, and I'll do it on myself if I wake up in the middle of the night and my arm is not feeling great. You can try that. Okay, everybody got that one? So now we're gonna go to the face. So last week we talked about the autonomic nervous system, and so we did some face release, and we've done some facial release, we've done some neck release. We're gonna actually work our way back up to the forehead. So this is a place where we hold a lot of tension. And even if you hold a funny facial position, like, it's gonna create a lot of tension here. So this is where we're gonna focus. So there are two main nerves. There's one nerve that exits the skull right on the inside of your eyebrow. And usually if you poke around, you're gonna find one spot, might be one side versus the other, that's a little more tender than the rest. So remember that. Then right above, like if you drew a line right on the middle of your eyeball, there's another big nerve here. So when we are making weird facial expressions or we're just tense, the whole forehead's gonna feel a little bit weird. So we're gonna release both of those. So the first one is if you put the palms, hope everybody's hands are washed, you're gonna put the palms of your hands like right on the inside of that eyebrow. And then what I want you to do is you're gonna kind of like, you're pulling the bottom of your palms away from each other. And you're not pressing really hard, you're actually just grabbing the skin and pulling apart. It might feel like you're ripping the skin, and I don't want it to be that intense, but that's what it might feel, even though it's a really, really light pressure. And that's a fascial release that you can get. And like I said, the pressure does not have to be that intense. And you're gonna pull the skin apart. This one's one of my favorites for headache release, because you can also just rest your head in your hands and pull apart a little bit, so that just the weight of your head is gonna be enough to create some, and don't do this before like a photo shoot or anything, because it will cause this nice red mark in the middle of your forehead. I love this one for on the fly headache release, like you're standing in line at the bank and you have this pressure. That's a really good one. Then the next one is so we're gonna go to the little nerve that exits here. If you find that little tender spot, you can literally put a little bit of pressure and then almost like you are pushing away with just your fingertips, but they're a little bit lower than your eyebrow. And you're gonna just kind of grab the skin and push away. So this is another one that I like on the fly. And this also will stimulate some of that parasympathetic nervous system activity to help calm yourself down. And Corey just chimed in. He said, light pressure on the eyes, like an eye mask, lowers your heart rate. And just like all of those things that we talked about last week. So those are, yeah, so now my forehead feels real good. It also helps with those little wrinkle lines that we get here, releasing that. So that's really all I have for this week. Covered a lot of things really fast. Are there any questions that anybody has about anything that we talked about today? Awesome. Well, if there are suggestions for next week, I have a little list of people are making some great suggestions. And I'll continue to talk and speak to whatever anybody wants to. Otherwise, I, of course, always have my own laundry list of things that I think are pertinent at this time in our world. Digestion support. Yeah, absolutely. That's a great topic.
I had a question. You were talking about sleeping, and I am a snorer like no other, like next level. And so,
so I can't beyond my scope of practice.
Well, I can't tell everyone, but I'm just saying, I've read like what I've been doing if I do sleep with someone, because I'm like this poor other person besides give earplugs, is I sleep with my head elevated. I'm sure that's not good. Like really elevated.
Forward like this.
I put like 2 pillows underneath me, and I'm like as far up as I can get. I'm sure it's not good. Watching you do all that, I was like, oh, I should not be doing that. That's all I was thinking.
Well,
about.
I think it would definitely depend on the origin of where your snoring is occurring, but that is helpful. That stops your snoring.
Oh yeah, it can stop. I mean, rolling on your side is helpful, but I actually have one of those old people beds that you can push a button and it raises you. So if I'm in my bed, I just raise my side of the head and I literally won't snore.
Huh.
Throwing it out there. So I randomly, I just was, as you were showing all that stuff, I was like, oh, and I've had a bunch of shoulder pain lately, not the arm pain, but I think that it would help with because I was sleeping on my shoulder on that side. It's my bad shoulder. And I was like, oh, like some of those suggestions that you had about, putting that, I think would alleviate that pain. So thank you.
Yeah. Yeah. Give it a shot and let me know. And I'll think about your snoring issues.
It's really ruining my life. So yeah. Oh, wow.
Awesome.
Okay. Thank you. I'll send you a few Marco Polos. He's snoring in the middle of the night. Don't worry.
I look forward to that.
Okay. I'll see you guys. Thank you.
Yeah. And I see some awesome names on here and some great faces. I wish I could sit here and talk to everybody, but it's good to see all of you. So awesome, guys. Well, thank you. Have a great Monday. Have a great week. And I look forward to seeing everybody next week.